insomnia, anxiety, and depression hidden connection about which you should know. Watch this video to the end and you will learn about the specific symptoms of sleep disorders that indicate that you have developed depression. Often patients come with complaints at the reception saying that they sleep poorly or vice versa, and that they wake up in the middle of the night and then cannot fall asleep until morning. That is the so-called early awakening with the inability to fall asleep again. So if a person is stressed, worried, and restless, this can often disrupt sleep. There is even such a concept as reactive sleep. There is even a so-called 4 test where several descriptions of events that can potentially worsen the quality of sleep are given, and the person answering these questions gets a certain score, which says that he has reactive sleep, but this is such a complex enough test. There is a very simple question that I ask my patients, and this shows that the person has reactive sleep. I also ask, were there times in your younger years when your sleep was disrupted before any important events? With trains, exams, good, bad, but somehow emotionally important events for you. If a person says yes, it usually means they have a type of nervous system that reacts to stressful situations by disrupting sleep, because there are other people who, on the contrary, develop sleepiness. They lie down and, so to speak, sleep off and remove the stressful situation. So, if a person has reactive sleep and he has experienced some stressful situation, then he sleeps poorly. If the stresses are regular enough, it can lead to the development of an anxious state. And this is when it's not even the stress itself, but the anticipation of some unpleasantness, that is, some events are unrealistically happening to a person, but he thinks about it, he worries, he predicts that something bad might happen. That is, this constant worry is actually called anxiety. And this accordingly leads to the fact that sleep begins to be regularly disturbed. That is, a person experiences frequent problems with falling asleep. And here, by the way, there is a certain peculiarity and perhaps even a certain life hack, that if some stressful situation has started and it has worsened your sleep, and you are lying and trying to fall asleep, 15 to 20 attempts to fall asleep are enough, and you can't against the background of a lingering stressful situation. You may develop a strong conditioned reflex of fear of not falling asleep and insomnia. And the stressful situation itself may end, but this reflex will remain. In connection with this, if you have reactive sleep, some lingering stressful situation, you went to bed and did not fall asleep, a very simple advice. Don't lie in bed for more than 15 minutes without sleep. Get up, go to another room, engage in some boring activity until you want to sleep. A man says, but how so I can't sleep? Yes, to some extent you don't get enough sleep. But if you lie in bed, you definitely won't get enough sleep either. You'll lie there, tormenting yourself as you try to sleep. Engaging in a boring activity can gradually calm your nervous system. And the time it will take for you to fall asleep will be approximately the same. You won't get much sleep tonight to some extent. You will accumulate what is called a sleep deficit, or even, I say, a sleep elixir, which will allow you to sleep better the next night. But what happens, people also describe. I, doctor, had stress, I didn't sleep, and it dragged on for some time, and then paradoxically I started to sleep better, but I started to have early awakenings. For example, my alarm is set for 7 a.m., but I woke up at 6 a.m. and can't fall back asleep. Then at 5, then at 4. And such awakenings with such a, as it were, jolt, with a clear more or less consciousness, a stream of difficult-to-stop thoughts, and I think, some negative thoughts, and now the alarm clock is ringing, it's time to get up, and I'm already tired of thinking. The entire following day is spent exhausted, drained, and sleep-deprived. This is the transition from an anxious state to a depressive state, or the addition of a depressive state. What also happens is when a patient comes in and says, doctor, I laid down 3 months ago and didn't fall asleep. I didn't sleep all night. The very next night, I again got no sleep whatsoever. Then I slept for about an hour, and since then, for 3 months, I've practically not slept at all. I sleep for an hour at most. At the same time, I can't sleep at night, and I can't sleep during the day. And of course, it disorients a person. He thinks that he practically doesn't sleep at all. He tries, he suffers, nothing works out for him. He goes to the doctor listens. He expresses shock at her lack of sleep for 3 months and immediately offers her sleeping pills. But this is the so-called phenomenon of sleep perception disorder, when a person sleeps but thinks that he does not sleep. And this situation often speaks of a sharp development of a depressive state with a phenomenon of disturbance with sleep perception. And in this situation, when we objectively look and control in a human way, there are such studies that show that these 3 months of a person who says that he did not sleep at all, yes, he slept worse, intermittently, sleep may have become somewhat more superficial, but the total overall duration of sleep is practically the same as before he experienced insomnia. A person subjectively thinks that he does not sleep at all. And here is a certain problem with the doctor's assessment of this situation. Imagine a patient comes to the doctor and says, "Doctor, I haven't slept for a month, 2, 3, practically at all." And what does the doctor do? And he believes the patient. He says, "Yes, really, let's give you some pills." In reality, the person is asleep but believes they are awake. In this case, sleeping pills are almost ineffective. Let's take another situation. A patient doctor comes in and says, "Doctor, I have a temperature of 38 and give me a sick leave. I can't go to work." So what does the doctor do? Does he give sick leave? Actually, he measures the temperature first. And the person seems to have a temperature of 36.6. Well, what will the doctor say? "Yes, you old man are a simulator. Get out of here." A man tells his doctor he hasn't slept in 3 months. Although, in principle, such a thing cannot be. The documented world record for sleep deprivation is only 11 days. If a person doesn't sleep for 3 days, they become incapacitated, they can't perform any sequential work. Within 4 or 5 days, the person starts hallucinating and becomes delirious. Unfortunately, in most cases, we do not perform the so-called polysomnography. By the way, in our center, this is the main method of diagnosis. When a person says, "I don't sleep," we say, "Great, let's take a look." And we conduct a study. We put sensors on a person, a polysomnographic study, which essentially monitors sleep. We observe that the individual slept for 7 hours, for instance. Yes, with awakenings, but sleep quality may suffer. The person says they only slept for an hour. This speaks to the fact that the person has a clear phenomenon of sleep and perception disorders, and this is usually a manifestation of a depressive state, and it needs to be treated accordingly. You know, there are such tragic situations when a big businessman comes to me who has been in constant lawsuits for 2 years. There was practically a bankruptcy at the edge, but he says, a month ago they gave me some antibiotic, I had diarrhea after that, and I stopped sleeping, and I haven't slept for a month already. Or, as one sufficiently high-ranking military man tells me, that I quarreled with my mother 2 months ago and haven't slept for 2 months already. They don't associate this with taking pills or arguing with my mother, but this soldier had been fulfilling his duties for nearly 2 years prior. So, if such a situation occurred with sudden loss of sleep, as a rule, one needs to carefully examine oneself and maybe have a doctor analyze what was happening for a month, 2, 3, half a year, sometimes a year, before the sleep suddenly disappeared. And as a rule, it turns out that some kind of prolonged stressful situation arose with which the person could not cope psychologically. Or it's a series of these prolonged situations that gradually accumulated, but the problem kept piling up, and then at one point there was a psychological breakdown and the person stopped sleeping. Literally today a woman wrote to me on social media, "Doctor, I haven't slept for several months. I went on the internet and read about fatal familial insomnia. But it's actually a hereditary disease. When certain genes are damaged and we start to have such defective proteins in the brain, and eventually the sleep centers are damaged. They stop generating sleep, the person stops sleeping, and within half a year everyone dies." And this girl writes to me, "I probably have fatal familial insomnia." I reply to her, it's still a very rare disease. About 50 families with a predominance in Italy are described. And I read that there are sporadic random cases. Maybe I have exactly this mutation and it happened. Such cases are also described, but they are 1 person per 100 million. In Russia, such a thing has never been described. But a person is so worried about this that he can't sleep. Just to a significant extent in this situation, a person himself needs to understand that such a thing does not happen. Well, secondly, the doctor needs to understand that this is specifically due to a depressive state, and specific treatment needs to be carried out. But this is already a medical task. And if you don't sleep at all, you should see a sleep specialist who will first of all explain to you that this doesn't happen. And secondly, he will try to figure out the reasons for the development of this insomnia when you stopped sleeping. Most likely it will be conditioned by some preceding lingering stress situations, the development of depression, or the phenomenon of sleep perception disorder. And the corresponding treatment allows to deal with this very effectively.
And if I didn't suspect depression, came to you as a sleep specialist, I have problems with sleep, but at the same time I have depression, I don't know about it, and you don't know about it. As a doctor, can you suspect it based on certain conditions and refer me somewhere to have it confirmed?
Sleep specialists are well versed in clinical psychology, although we may not be psychiatrists. I have an additional specialization in clinical psychology myself. And, by the way, when a patient with insomnia comes to me, they all fill out questionnaires. There is such a hospital scale of anxiety and depression, and as a rule, filling out the scale itself and the ball assessment already gives a preliminary characteristic of a person, and in general, it is quite accurate, that is validated, so-called, that is, it shows on a large number of people that yes, with the help of this scale, you can suspect depression. Next, we assess whether this is endogenous depression, well, that is psychiatric depression, or it is a reaction to chronic stress. Well, it's also important to assess so-called somatized depressions. When a person says that his head hurts, his stomach hurts, he has an ulcer of the duodenum. This can also be a coexisting situation with chronic stress and depression. But yes, this can be suspected just by thoroughly questioning the person, collecting anamnesis, and conducting some additional surveys, or once again thoroughly clarifying the anamnesis of the person. How can you suspect that you are indeed developing depression? This is when you start waking up earlier than you would like to. Well, let's say the alarm is set for 7, but you wake up at 6. And the earlier you start waking up, the more it means that the depressive state is progressing. Sometimes a person goes to bed at 11 o'clock, and by 1 o'clock they're awake, agonizing in thought until 7 in the morning. This says that this situation is already serious enough. It unfortunately requires a visit to a doctor and the adoption of appropriate, sometimes medicinal methods of treatment or cognitive behavioral therapy for depression and insomnia. And secondly, if you just had a terrible day, went to bed at night and didn't fall asleep, and then practically didn't sleep at all, this can also indicate a depressive state that has developed against the background of some ongoing chronic stress situation. Usually, unfortunately, it does not go away on its own, it gets worse, and this also requires professional help. And here it's also important, as I said, that when a person comes for a consultation, he says, "Doctor, I'm sleepy during the day. That is, I don't sleep at night, but I'm sleepy during the day." I say, let's clarify, because there are clear criteria for sleepiness. You sat down at the computer and fell asleep. You fell asleep while reading a book. You sat in the transport and fell asleep. That's real sleepiness. And when a person says that I'm tired, broken, and I even try to close my eyes, but sleep doesn't come, that's not real sleepiness. It's fatigue, exhaustion, but not sleepiness. And this is also a quite characteristic symptom of a depressive state with the phenomenon of sleep disturbance. That is, a person slept at night, but he didn't realize that he slept. He thinks that he doesn't sleep. He has daytime sleepiness. But since the brain slept at night, he still won't sleep during the day. And such patients really don't have sleepiness. If you have suspected depression in yourself or your doctor has diagnosed it, please write in the comments what symptoms you have experienced. Did you have insomnia? Was there a phenomenon of disturbed sleep perception? Perhaps you have questions we can discuss.